Between 2021 and 2022, approximately 150,000 healthcare workers have left their jobs. Let that sink in. 150,000 professionals who dedicated their lives to healing others have walked away. Now, the question is, why? And more importantly, what does this mean for the future of healthcare? Hi there, I'm Dr. Santina, or Tina Wheat. I am a family physician educator, and I'm also a career and life coach who is dedicated to helping healthcare workers conquer their chaos and get to calm. Now, if you are in healthcare, I bet that you have either thought about leaving or know someone who has. I have, and the truth is, this isn't just about individuals' career choices. It is about a system that is failing its workers and ultimately its patients. We are going to dive deep into the reasons behind this mass exodus, the real struggles healthcare workers are facing, and what can be done before our system collapses under the weight of burnout and broken support structures. Now, I think most of us can admit that the healthcare system is facing a crisis. This is not just in patient care, but in retaining the very people who keep it running. Nurses, doctors, therapists, and other medical professionals are leaving in record numbers. And while some may dismiss this as just another workforce shift, the reality is far more alarming. Without enough healthcare workers, patient care suffers, wait times increase, and the system crumbles. So why do we see this happening? Well, ask any healthcare worker, and they will tell you the job is just not what it used to be or what they thought it would be. Many are reaching a breaking point due to three major issues: burnout, lack of institutional support, and the feel of unsafe working conditions. These are all things that I have felt myself. So let's talk a little bit more about each of these reasons. And let's start with burnout. We know that there's long shifts, there are overwhelming patient loads, and there's emotional exhaustion. And all of these things are pushing healthcare workers past their limits. A recent survey found that over 60% of nurses and 40% of doctors report that they feel burnout. And I will say that many of us entered this field because we wanted to make a difference. That's why I got into this field. But what is the reality? Many are feeling stretched so thin that there's not even time to properly care for our patients, let alone ourselves. I felt that so deeply before I found my path out of burnout. Now, the second is the lack of support. And this is not just individual support, this is institutional support. We see understaffing, lack of mental health resources, and also limited career growth opportunities. And these all leave healthcare professionals to feel stuck and unappreciated. We are all told to be resilient, but resilience doesn't fix a broken system. We don't need more self-care tips from the system. We need systemic change. Now, that doesn't let go of the need for us to take care of ourselves, but the system also needs to take care of itself. Let's move on to number 3, unsafe working conditions. We have seen short staffing. We have seen increased workplace violence. Healthcare workers are facing risks that go beyond just patient care. We are not just burned out. Some are actually in danger. And that's not even counting the hospitals and clinics that have been forced to shut down departments or even close altogether. In many areas, access to care is extremely limited, if not disappearing altogether. So let's talk about what this looks like in practice. There are so many examples, but to protect privacy, I am just going to use an illustration. So take an ICU nurse who has spent the last decade in the field. She used to love her job, but after years of increasing patient loads, emotional exhaustion, and little support from leadership, she made the tough decision to leave, and to leave nursing altogether. And she is not alone. I spent much of my time in the hospital on labor and delivery. I watched nurse after nurse shift their hours, or become per diem, or leave altogether. I watched many of my physician colleagues reduce their hours. Some even considered leaving medicine completely. And this isn't just happening in one department or one hospital. This is everywhere. I considered leaving medicine myself. In a recent study, nearly 1/3 of healthcare workers said that they plan to leave their roles within the next 2 years. If that happens, we are looking at a healthcare system that is completely in freefall. But here is the real danger behind all of this. When healthcare workers leave, patients suffer. Who will take care of them? We see longer ER wait times. We see delayed surgeries. We see overworked staff. These aren't just minor inconveniences. They can be life-threatening realities. The very people that we trust to heal us are running on empty, and that should concern all of us. And then patients feel like they're not being cared for, and that makes their healthcare team more upset, and the cycle can just worsen and worsen. A burnt-out doctor or a burnt-out nurse is more likely to make a mistake. An understaffed hospital is more likely to miss a critical diagnosis. A nurse working a double shift is more likely to experience compassion fatigue. This is not just a workforce issue. This is a patient safety crisis. So I've laid out problems, but what is the solution? The truth is there's not just one solution. We have to work at many levels. We need to make system-level changes. This is addressing burnout, improving staffing ratios, and providing real support for our healthcare workers. We have to make institutional level changes, leadership accountability, fair pay, and safe work environments. And we also have to take individual level actions. Even in a broken system, you can still take steps to protect your well-being. Whether that means setting boundaries, finding mentorship, seeking career guidance, or a coach. This is not just a hospital issue, though. This is a societal one. The people who take care of us deserve to be taken care of too. Now, I want to hear from you. If you are in healthcare, have you considered leaving? Also, what is the biggest challenge that you're facing? I hope you'll drop a comment below. I'll read every single one, and I'll use them to talk about solutions. And if you're interested in those solutions, reach out. We have to work together at the level of the individual, the institution, and the system. If you need support figuring out your next steps, whether it's staying, setting boundaries, or making career shifts, I can help. Let's start that conversation. And if this was helpful for you, then I hope you'll take a few moments to like, subscribe, and share this video. Because the more people who understand this issue, the more pressure we can put on the system and society to change.